My name is Michael Chater. I'm the Arms House Manager at Doughty's, which is part of Norwich Consolidated Charities. We're an alms house, so we're providing extra care housing for older people who've lived in Norwich for a certain period of time. My role is generally as a sort of more of a general manager. I have a management team who are very experienced. I love getting people to work together as a group and seeing what people can do when they're working together as a team. That to me is one of the main reasons I like being in leadership, more so than anything else. If you get people and you can see a change in a group of people because they've achieved something that they couldn't do on their own or they didn't think they could do on their own, but you can just show people how they can do that. It's not you doing it, you allow other people to realise the potential of themselves individually. As soon as I came here, the first week I realised every Wednesday we have a coffee morning, and I was expected to go to the coffee morning. That was my favourite thing, just to sit down with our residents, to have a conversation with them, to realise how their week's been. Is there anything that I can do to make any changes, put things in place to support them? That to me is, to use a cliche, is priceless. It's about people, and to me that's crucial in life in general. It's all about people.
My name's Jo Tier. I work for a company called Extra Hands, a domiciliary agency, and my role is Director of Care Services. When I first came into this industry, I was unsure because I thought that you had to be qualified. It was only when I came into the role that I realised actually it's about attitude, about you as a person that makes the difference. I came into the industry in 1994 and it was purely looking for something that I could do that worked around my family. Now I've progressed on to the Director of Care Services, so over 25 years in the industry. There's lots of career progression within the care industry and there's lots of different ways that you can lead off once you've been a carer. I've employed carers that have gone on to be social workers, so there's lots of opportunities there. It's a very diverse role. Every single day is different. Every day makes a difference to people. And I think that most people that do it and stay in the industry feel that they get a lot out of it.
I'm Ed Fraser. I'm the Programme Manager for the European Social Fund Developing Skills in Health and Social Care programme, and it aims to improve access to training and education opportunities for the health and social care workforce across Norfolk and Suffolk. I left university with a real desire to work somewhere where I felt I was making a difference. I spent 4 years working for Healthwatch Norfolk, which is the local representative for patients and the public. I found it really rewarding, giving a voice to people who otherwise wouldn't be able to make themselves heard. We're facing an unprecedented demand for our services and we have to think differently about how we can continue to provide the care and support that we need to do. And one of the huge benefits of working for an organisation like Norfolk County Council is we all get to work together to think about how we can improve things for the people living in our local society.
My name is Christine Footer. I'm the Chief Operating Officer of Norfolk and Suffolk Care Support. I came into social care really by accident in a way, apart from the fact that I'd always had a very strong sense of social justice from a very young age. I came from a working class background and I got a degree. I was the first person in my family to get a degree and I didn't really know what to do with the degree, so whilst I was academically trained, I then didn't know what to do. So I did a number of different jobs. I worked in the benefit office, I lived and worked abroad for a while and then came to live in Norfolk. And I applied for a job as a home help organiser, as it was called then, in 1987. I just realised that I'd come into something where I really wanted to stay and progress. Now working at Norfolk and Suffolk Care Support, it's all about information and advice and guidance for the social care sector. So we connect people with training, learning and development. We also go into schools and colleges and we talk about careers in social care. The reason I love the job that I do is because you can work with people and you can hear people's stories and you can really get to know people. And I think it's understanding that we're all very different and we've all got our own strengths. And it's about seeing beyond conditions, disabilities, but actually talking to people as people. And I think if you love working in that environment, you're just going to love social care.